our pointers, and let me begin by giving you some of the things that if I were the student who will be taking the test anytime soon, these are the drugs that I have to focus on. Here we go. First, you have tamsulosin. Yeah, that's how you pronounce it. Tamsulosin, not tamsulosin. Tamsulosin. Charing. That's the social way. Tamsulosin. Okay. So this medication is used for the treatment of benign prostatic hypertrophy. In essence, question is, what will it do? Remember, for tamsulosin, you have to know the outcome. And the outcome of taking the medication is related to decreasing the common symptoms of BPH. Now, we know for a fact the common symptoms of BPH are frequency, urgency, hesitancy, nocturia, decreased size and force, and urinary stream. So therefore, how would you know that tamsulosin is effective? So it will decrease, remember the code, WIN PF, okay? You will win your professional fee. So WIN PF, but WIN is spelled as WHIN. So W, it will decrease weak stream of urine. It will decrease hesitancy. It will decrease incomplete emptying of the bladder. And then N, it will decrease nocturia. WIN, WHIN, weak stream, hesitancy, incomplete emptying of the bladder, and nocturia. And then PF, it will decrease painful urination, and it will decrease frequency. In essence, the primary symptoms of your BPH will be decreased when tamsulosin is used. Now, the next question of the patient would probably be, when is the best time to take the medication? Take note, the medication should be in your system for a good 6 hours at least. Therefore, the best time to take the medication should be the morning after breakfast, in the morning after breakfast, or after the first meal, or after the first snack of the day. So for as long as you're taking it in the morning and it's staying in your system for a good 6 hours, it would help in the management of BPH. However, what do you need to check if your patient is taking tamsulosin? Take note, you will need to focus on how the kidneys of the patient are excreting the medication. So you will have to check the creatinine clearance. If the creatinine clearance is less than 10 ml per minute, then the use of tamsulosin is contraindicated. Why? It simply means that the kidneys of the patient are not healthy enough to promote the excretion of the medication. So there's a great potential that the medication could accumulate in the body and would eventually damage the kidneys. Okay? So next important thing, you have your Neuroleptic Malignant Syndrome, NMS. Now, your neuroleptic malignant syndrome is an adverse effect associated with your neuroleptics or major antipsychotics, okay? Major tranquilizers or antipsychotics. Now, the most common antipsychotic in which NMS is associated with is your haloperidol or Haldol. Now, haloperidol is a typical, so it's typical antipsychotic. So why do we have to highlight that haloperidol is typical antipsychotic? Because take note, typical antipsychotics will just decrease the positive symptoms of schizophrenia, whereas your atypical antipsychotics like your Loxapine will decrease both the positive and the negative symptoms of schizophrenia. So haloperidol is typical antipsychotic. So it will just decrease the positive symptoms of schizophrenia. Remember the code DH low AC. So it will decrease delusions, hallucinations, looseness of association, agitation, word salad, ambivalence, and confusion. So your haloperidol will not, take note, it will not decrease your apathy. It will not decrease your alogia or poverty of speech. It will not decrease your anhedonia or lack of interest in pleasurable things, including sex. And it will not decrease your asociality, including your avolition or lack of motivation. Those negative symptoms will be decreased by your clozapine, which is an atypical antipsychotic. Now, what syndrome would tell you that your patient is having neuroleptic malignant syndrome? In essence, what are a group of signs and symptoms? Take note. First and foremost, take a look at the vital signs. There's usually very high fever, hyperpyrexia, above 38 degrees centigrade or above 102 to 104 degrees Fahrenheit. Okay, then you have elevated pulse rate, elevated respiratory rate, but take note, the blood pressure is fluctuating or unstable. Sometimes you have a very high BP, sometimes you have low BP. So the abnormalities in vital signs coupled with muscle rigidity and diaphoresis together with altered level of consciousness that defines your neuroleptic malignant syndrome. Now, question, what should be the priorities for neuroleptic malignant syndrome? First and foremost, since you have very high fever, the priority should be to lower down the temperature. So what is your priority? Administer your bromocriptine that will decrease the temperature, and then you need to decrease muscle rigidity. And there are two drugs that could be given. You have your dantrolene to decrease muscle rigidity or amantadine to decrease muscle rigidity. So two priorities, decrease the temperature and to decrease muscle rigidity. The medication to decrease the body temperature would be bromocriptine. The medication to decrease the muscle rigidity could either be your dantrolene or amantadine. Okay, so let's move on to the next. Okay, the next one would be your folic acid. We all know that folic acid can be sourced from green leafy vegetables, okay? However, okay, for non-pregnant patients, the requirement would be 400 micrograms per day. For pregnant patients, you will have to increase that to 600 micrograms per day. So therefore, pregnant patients will need to receive additional folic acid in the form of tablets in order to prevent neural tube defects or to prevent spina bifida or myelomeningocele or meningomyelocele, okay? So your folic acid is essential for the prevention of your neural tube defect. Therefore, what are the common sources of folic acid? Remember your A, B, C. So A would be asparagus and avocado, so vegetable and fruit. B would be beans, broccoli, and banana, once again, vegetables and fruits. And then C, you have citrus fruits, cauliflower, and chickpea. So once again, vegetables and fruits. So green leafy vegetables would be very high in folic acid. Now, however, if you are giving folic acid tablets, what should you instruct your patient? The absorption of folic acid is decreased by the intake of tea. Therefore, instruct the patient to take folic acid tablets with water and avoid tea because tea decreases the absorption of folic acid. Now, take note, if the patient would ask you, when is the best time to take your folic acid? It could be taken in the morning or in the evening with or without food for as long as you're not drinking it with tea. Avoid tea, okay? Now, take note, your folic acid is your vitamin B9 that will help prevent neural tube defect. Avoid tea, remember. Okay, so, and the second specific preparation for the NCLEX, you have to have the appropriate technology when you're studying. Okay, take note, our learning tools are uniquely created based on Gen Z learner characteristics of the Ray Gapuz system. I am the first Filipino author, so blessed to have written a book for the world's #1 healthcare publishers, Mosby Elsevier. That's Essential Concepts for the Philippine Nurse Licensure Exam. Take note, it sold 50,000 copies and it won in the International Book Awards, the first Filipino book to have won that award. And of course, we have our own system. So it's called the Ray Gapuz Core Shell. So it's available for $149 for unlimited access for our QBank as well as next generation NCLEX-RN sample question in the style that you will see in the actual test. Okay. And of course, you have NCLEX-RN in a flash published by Jones and Bartlett USA. The local title of this book is NCLEX 311. Okay, so these are the Ray Gapuz core shells, which you can avail of for a very, very low fee of $149. Okay, so, and the most important thing of them all when you're studying, you have to be in a conducive environment. This is the kind of environment where we conduct our classes at the Ray Gapuz system. This is our NCLEX simulation room with limited number of students. And of course, this is how we do our classes and our boot camp. Please do register anytime soon because classes usually gets full early every month. We do every month or monthly schedule. We have an AM or PM class. Or if you want to get it exclusively over the weekend, you want a delayed telecast, unlimited video watching, or if you want, okay, you can just attend the weekend. It's your choice of live face-to-face class or live virtual class or on-demand unlimited video recorded lessons. And then you get a copy of my 3 books plus the Q bank plus next generation NCLEX-RN strategies and sample questions and quick fix sessions. You will get that for free. So take note, this is what we call the next generation NCLEX-RN Flex, the most flexible test preparation class for the NCLEX-RN. So I'll see you in any of those classes. Once again, this is your mentor, your fact check buddy, Ray Gapuz, saying you can do it if you know your functional concepts. For those of you who may want to watch my lengthy videos, we still have it here. Look for our quick fix video for the NCLEX. See you in my next video. What are the things that I want to advise you to focus on, especially those who are taking the test in the next few days? The first one is about hip arthroplasty. Now, what are the things that you have to focus on this? Don't be too technical about memorizing what the surgery would entail, about the things that the doctor should have been telling to the patient. No. Focus on how will you provide post-operative care to the patient, specifically on the instructions which you will tell them on discharge. So discharge instructions. So first and foremost, instruct the patient after hip arthroplasty to always sit upright, okay, at 90-degree angle. So they have to raise their toilet seats. Instruct them not to bend too far forward, which means they should not be tying their shoelaces. They can use shoes with Velcro straps or ask somebody to tie the shoelaces for them. And then instruct them not to cross their legs, whether they're sitting, standing, or lying down. No crossing of legs. Now, another important thing that I'd like you to focus on related to hip arthroplasty would be the potential complication. So if a patient is post-hip arthroplasty, there could be a potential for the patient to develop deep vein thrombosis. And there are 3 factors to consider why a patient post-hip arthroplasty is at risk for deep vein thrombosis. One is immobility. Second is blood stasis. And third is the thickening of the blood. And this is where your pneumatic compression device should be provided to the patient to prevent DVT. However, remember that if your patient is using the pneumatic compression device for prevention of DVT, instruct them not to wear it when going to the comfort room because it increases the risk for falls. Now, remember, the pneumatic compression device or sequential compression device is used for prevention of DVT. It's not used as a treatment. And once the patient is wearing it, they should wear it continuously. However, if they need to go to the bathroom and they spend more than 2 hours in the bathroom, if they have disconnected the sequential compression device or pneumatic compression device for more than 2 hours, the nurse should need to obtain another doctor's order before it is reapplied. Because definitely, if you've not been wearing it for more than 2 hours, there's increased risk for deep vein thrombosis. Now, the next question that the patient would ask you would be, when can I start to drive? Usually that's after 6 weeks. Remember the 666 rule. 6 weeks after, they can start to drive. And when they enter the car, it should be the butt first and then pivot towards the front. Okay, so butt first, pivot towards the front. Then hold on to the steering wheel. And then your return to work could actually take place after another 6 weeks. So 6 weeks for driving, 6 weeks before the return to work, or sometimes it could extend up to 12 weeks. And of course, the most common concern of the patient, because this is also a physiologic need. When can they return to engage in sex? Usually also after 6 weeks. 6 weeks for driving, 6 weeks for returning to work, 6 weeks also before they can engage in sex. Okay, remember, that's the 666 rule. Okay, so let's move on. The second important thing that I'd like you to focus on would be osteoporosis. Osteoporosis, remember, refers to loss of bone density. So you will need to increase calcium in the diet of the patient, and definitely to increase vitamin D. Very, very important. And you will have to instruct the patient to avoid foods and drinks or beverages that contain phosphates. Example would be your soda. Why? Your increase in phosphates could definitely decrease the absorption of calcium. Okay, now what do I want you to focus on related to osteoporosis? The risk factors. Okay, so remember the code MENS phase. So MENS, MENS, M, menopause. So after menopause, the patient is at risk for osteoporosis, and then estrogen, that's decreased, okay? And then N, nutrition, a decrease in vitamin D and calcium will increase the risk for osteoporosis, so you need to increase vitamin D and calcium. Then S, smoking and alcohol drinking, okay? So that makes your first word MENS. And then FACE, F-A-C-E, family history of fracture. So if the parents of the patients have had fractures when they were an elderly, that could be an indicator that the patient is also at risk for trauma or fracture related to osteoporosis. And then advancing age, this is common in the elderly. Caucasians and Asians, they are at risk for osteoporosis simply because for Asians, a lot of Chinese, Koreans, and Japanese are lactose intolerant. And we know for a fact that milk is a good source of calcium. So if they are lactose intolerant, they can't take milk. So definitely their calcium intake would be lesser. And of course, ethnicity. So once again, family history of fractures, that's F, A, age, C, Caucasian and Asian, and then E, ethnicity. So remember, men's face the risk factors for osteoporosis. Is that a concept? Let's move on to alendronate or Fosamax. So Fosamax is actually a biphosphonate. It's used in the treatment of osteoporosis as well as your Paget's disease of the bone, okay? So in Paget's disease of the bone, the most common bone that is affected is the pelvis. What happens? The bones become larger and weaker, and there are two common manifestations of Paget's disease. One is pain, and then two is change in shape. So if your patient is taking alendronate, what are the common side effects? So the patient would experience NDCC. So nausea, diarrhea, constipation. The other C would be cramps or muscle spasm. So NDCC, nausea, diarrhea, constipation, cramps, and muscle spasm. Now, how will you instruct your patient to take your alendronate or Fosamax? Remember, there are some beverages that may potentially decrease the absorption of alendronate. Instruct the patient to take it with plain water or distilled water, never mineral water, because mineral water will decrease the absorption of alendronate by 10%. So therefore, you also need to instruct the client to avoid taking alendronate or Fosamax with tea, coffee, juice, or milk. Do not take it with tea, coffee, juice, or milk. And then the medication must be swallowed whole. Instruct the patient not to chew or crush the medication. Okay, so the second important aspect of your NGN preparation should be the use of technology. So here at the Gapuz system, we have unique learning tools that are based on Gen Z characteristics. Remember, the first Filipino authored nursing test preparation guidebook from Mosby Elsevier was written by yours truly. It's the first Filipino test preparations guidebook that won in the International Book Awards in the US. And of course, my other book for the nclex-pn, nclex-pn in Flash, which is also a finalist in the International Book Awards. It's published by Jones and Bartlett USA. So if you would see the sounders, and then there's ABC of Passing the NCLEX by Ray Gapuz. I'm so glad to have been given the opportunity to write and create my learning tools for all of you. So this is our latest technology, the Ray Gapuz Core Shell, that covers all the subjects on the test, like safety and infection control, basic care and comfort, health promotion and maintenance, management of care, physiological adaptation, reduction of risk potential, and psychosocial integrity. So all 8 subject areas on the NCLEX are covered. And you can use this anytime, anyway, with unlimited access, okay? And of course, the third and the most important, you have to have a conducive environment when you are preparing for your test. So this is the Ray Gapuz NCLEX simulation room, second floor of the Ray Gapuz building here at UN Avenue in Manila. And of course, this is how intimate our classes for our NCLEX RN. Now, may I invite you to avail of our next generation NCLEX RN Flex, the most flexible test preparation class for the NCLEX RN. It's your choice of live face-to-face class, live virtual class, on-demand unlimited video recorded lessons, your QBA plus 3 books, and then your next generation strategies and sample questions plus quick fix session. So you have available schedules for the morning, afternoon sessions only, or the weekend classes only are available, and the fee starts at 3,499. So to avail, give us a call at 0906-201-9383 or send us a message at our email address, info@ragapuzreview.com. So once again, this is your mentor, your fact check buddy, Ray Gapuz, saying thank you for your trust to the Ray Gapuz system, and see you in our next video. A functional concept a day keeps your NCLEX RN fears away. Take care and enjoy the rest of the day. Topics to focus on. And here are my pointers in this video. So first, septic shock. When you say septic shock, this could be a complication of infection. So therefore, if you think about the risk factors, any condition in which the client is predisposed to develop infection could be a risk factor. So remember the code DRUM-BEAT, D-R-U-M. Okay, D, diabetes mellitus, that increases the risk for infection. R, resistance, that is low, or the presence of respiratory infection, that's the most common cause of septic shock, respiratory infection. Use of corticosteroids, so the patient is immunocompromised, leading to low resistance to infection. So the same is true for patients undergoing chemotherapy and radiation therapy. Then malignancy or cancer. And then you have DRUM, then BEAT, B-E-A-T, burn. So a burn patient, remember the skin is the first line of defense against infection. So if the patient gets the skin burn, so they are at risk for infection. Next, environmental factors, meaning if the patient is in the hospital for a long period of time and the patient has catheter, they are at risk for ascending infection. Then age, that could be extreme. So the very young and the very old, the elderly above 60. And then T, trauma. Okay. And then the manifestations, since this is a shock state. Remember, the blood pressure is low. And then the temperature could be high, and sometimes it could be fluctuate. It could fluctuate to low temperatures. And the level of consciousness will definitely be decreased. Now, take note that the patient in septic shock could also be having fast but shallow breathing. Now, what would be the treatment? AFV. So A would be antibiotics. Remember, you have an infection. F would be fluids. And V would be vasopressor drugs. Remember, the blood pressure of the patient could be low. So norepinephrine could be given, okay, vasopressin, and of course, dobutamine. That is to expand the fluid volume of the patient. Okay, next, let's move on. Bacterial meningitis or meningococcal meningitis. Remember, let's differentiate it from viral meningitis in terms of isolation precaution. Viral meningitis requires standard precautions. Bacterial meningitis requires, take note, droplet precautions. And when you say droplet precautions, healthcare workers entering the room should wear the face mask because your Bacterial meningitis could be transmitted by sneezing or coughing. Now, what differentiates bacterial meningitis from viral meningitis would be the presence of petechial spots that could be bluish or brownish. Now, what symptoms would tell you, or in other words, what syndrome would tell you that the patient's having bacterial meningitis? First, you have fever, and then stiff neck. But take note, stiff neck may not be present in infants. It's difficult to assess stiff neck in infants. Rash that are petechial, bluish or brownish, usually in the trunk, and then photophobia and phonophobia. Because of the photophobia, provide them a darkened room. Because of the phonophobia, provide them a quiet room, okay? And then pay particular attention to the 4 vaccines that could help prevent bacterial meningitis. And these are your meningococcal vaccines, your pneumococcal vaccines, your Haemophilus influenza, and of course, your BCG. But of course, take note that BCG is for the prevention of Mycobacterium tuberculosis, and it's not widely used in the US, okay? So those are the things that I'd like you to remember for bacterial meningitis. And of course, the concept of malpractice. Now, let me differentiate this from negligence. Now, remember, when you say malpractice, just in negligence, there is an injury. And the injury has resulted from an act of commission or omission. The question is, by whom? So, if the act of commission or omission that has led to injury on the part of the patient was done or committed by a non-licensed personnel, then the case is negligence. If it is committed by a licensed personnel, then the case is malpractice. So for the RN, the case will be malpractice. That's why malpractice is shortly defined as professional negligence. So therefore, malpractice and your negligence have the same elements: duty, presence of a duty, breach of that duty, causation, and injury. So there is a relationship between the breach of duty and the injury, and that's what is called causation. Now take note, the most important element there is injury. You cannot sue for malpractice or negligence if there's no injury. So therefore, what if you are asked on the test, what are examples of malpractice? This is a tip that I'd like to highlight. Look for situations that could potentially lead to injury to the patient. Like, for example, failure to identify the development of complications or worsening of the patient's condition. Definitely, that's malpractice. Failure to failure to follow instructions of the manufacturer related to the use of an equipment that could potentially lead to injury of the patient. So that is also a form of malpractice. Failure to raise the bedside rails and the patient fell off bed. So that could be indicative of malpractice. Failure to check on the absolute neutrophil count or the white blood cell of a patient who is on Loxapine, which is a typical antipsychotic, and so happened that you didn't check that the absolute neutrophil count and the white blood cells are already low, you still give the next dose, that's malpractice. Failure to check on the digoxin level before giving the drug, patient is already having manifestations of digoxin toxicity like nausea and vomiting that are persistent or persistent lack of appetite, and you still gave the next dose, that's a failure on your part to identify the worsening of the patient's condition. So that could potentially indicate malpractice. Look for the situations that could potentially cause harm or injury for the patient. And definitely, that's going to be an example of your malpractice. Okay? So when you're studying for the NCLEX, since this is already next generation NCLEX, it can't be that you just are relying on your paper-based materials. Now here at the Ray Gapuz Review Center, we combine paper-based materials with our latest technology product, which is our Ray Gapuz Core Shell. So we cover all the subject areas on the NCLEX, like safety and infection control, basic care and comfort, health promotion and maintenance, physiological adaptation, reduction of risk potential, and psychosocial integrity. Now, what are the components of the core shell? You can choose to have short quizzes, long quizzes, standard multiple choice questions, SATA questions, or the next gen items itself. We have a lot of next gen items, especially case studies, and you can access this anytime, anywhere. So it's actually very affordable. It's just $149 for unlimited access. And the next thing that you should do is to give us a ring now, right here, right now, if you want to pass the NCLEX, okay? And of course, the most important and the third element of passing the NCLEX, you have to be in a conducive environment. So that's a Ray Gapuz NCLEX simulation room at the Ray Gapuz building, second floor here in UN Avenue. And this is how intimate our face-to-face classes are. So see you in our next class. Book now because slots are usually being filled that fast. So may I invite you to take the next generation NCLEX Flex, the most flexible test prep class for the NCLEX RN. Your choice of live face-to-face class, live virtual class, on-demand unlimited video recorded lessons, your QBank plus 3 books, and of course, the next generation NCLEX strategies by me, okay, your mentor, Fact Check by Ray Gapuz, plus 24 hours conducted in 3 days of quick fix sessions. The fee starts at $3,499. You can choose between an AM or a PM schedule or just weekend classes. Once again, give us a call at 0906-201-9383 or send us a message at info@ragapuzreview.com. Once again, this is your mentor, your fact check buddy Ray Gapuz, saying a functional concept a day keeps your NCLEX RN fears away. See you in our next video. What are the things that you need to study? Now, these are the pointers that I'm going to discuss in this video. Let's begin. The impaired nurse. Of course, when you say the impaired nurse, an impaired nurse is a nurse who is unable to meet the requirements of the Code of Ethics and Standards of Practice of the profession and has cognitive, interpersonal, or psychomotor skills affected by two important things to note: psychiatric illness and or drug or alcohol abuse and addiction. So which means an impaired nurse could be a nurse who is suffering from psychosis. An impaired nurse could be a nurse who is suffering from a debilitating anxiety disorder, like for example, obsessive compulsive disorder, or a nurse who is a substance abuser, specifically an alcoholic, or someone who uses drugs. Okay, that's a reason why impaired nurses would usually have the closed door syndrome, which means they engage in a lot of break, like pee break, poo break, smoking break. They invent all types of reasons for them to go on a break. And sometimes they inject themselves not here on the upper extremities, but in between their toes, because nobody would check on your toes, okay? On their toes rather. So therefore, an impaired nurse is characterized by, we have the code impaired, inappropriate clothing. Sometimes even if they're already at home, they still wear their scrub suits. They are having mood swings, meaning they easily get irritated, preoccupation with death and illness, and they have very, very unprofessional conduct. Common example would be absenteeism at work. Increased personal phone time because they transact business over the phone. They have rigidity. They are unable to change plans. They have exaggerated self-importance, and they have difficulty in remembering procedures and instructions. You would know that you have an impaired colleague in your unit if you have a lot of instances in which your patients who are supposed to be receiving pain medications post-surgery are complaining of very, very severe pain. And yet, if you check their medication administration record, it says there that their pain medication has been given on time. Suspect that it could be an impaired nurse who has given them just placebo and they took the patient's medications like narcotics and injected it to themselves. So that's an indication when there's a lot of complaints related to pain coming from patients who should be given pain medications after surgery, and yet the medication record says that their pain medications have been given. Suspect that you have an impaired nurse if these things happen in your unit. Okay, second is domestic violence. This is also known as intimate partner violence. So this is cyclic in nature, which means there's a pattern of behavior that occurs in a relationship. And this is done for two things. The abuser wants to gain and maintain power and to gain and maintain control. Now remember, abuse comes in different forms. There are 5 common types. Remember the code PIPS. P, physical, E, emotional, E, economic, P, psychological, and S, sexual. Okay, so let's dig deep. The 2 most apparent would be physical because of the physical manifestations and sexual. Okay, how would you know that your partner is abusing you physically? So ask yourself, is he hurting me? So is your partner hurting you? Is your partner using a weapon to inflict pain on your body? Is your partner hitting you? Is your partner biting you? Is your partner burning you? So all of these things that they are doing to inflict physical pain is a form of domestic violence. Now, what about emotional abuse? How would you know that your partner is emotionally abusing you? So does your partner embarrass you in front of other people? Does your partner shout out you? Does your partner verbally abuses you? Do they undermine your accomplishments and achievement? They don't want to acknowledge your achievements. That's a form of emotional abuse. What about economic abuse? Does your partner make you too dependent on them controlling the finances? Or does your partner squander your resources or your money? Or does your partner not allow you to spend money which you have earned? Okay, that's economic abuse. Now, psychological abuse comes in the form of your partner making you feel that your decision is not worthy enough. So which means they make you feel like you are unable to make the right decision. That's a form of psychological abuse. Now, what about sexual abuse? Well, when your partner pressure you to engage in sex, or when they accuse you of cheating, or when they accuse you of having a boyfriend or a girlfriend on the side, or when they hold you down too tight during sex, or when they demand sex even if you are ill, that's a form of sexual abuse. Now, take note. What should be your priorities? Remember your LBC. Okay? First, listen. Then B, believe the victim. Listen to the victim, believe the victim, and C, call the appropriate authorities. So it's very important for you to give the victim the phone number of temporary shelter, because sometimes the problem of the victim would be, where will I go if I decide to leave my husband? So provide them with phone numbers of support groups, temporary shelter where they can go. And the most important thing is plan their safety, okay? So, and this includes digital safety. What does that mean? Well, instruct the patient to have a separate email, and then do not immediately delete your internet history if you're a victim of domestic violence, because that will alert the abuser, okay? Now, remember, text messaging is not a safe thing to do when you're dealing with an abuser. So call instead of using the text, and take note, use a computer that the abusive partner doesn't know about. That's the most important thing. Do not use a common gadget, because most abusers are very controlling. They want you to just use the same Facebook account that they have, the same Messenger account as they have, okay? Next, should you decide to leave your abusive partner, what are the things that you have to ensure? First, you have to have a post office box in your name, your PO box, and then you open a separate bank account and credit card in your name. Then you have to change locks if your abusive partner is familiar with where you're supposed to be going to. Tell friends and neighbors that your abuser is not living with you anymore, but don't go into detail. Don't share the details of the abusive relationship. Just tell them that the abuser is no longer living with you anymore. And then ask a friend or another person to screen the calls for you. So that simply means your phone should have a call divert feature, so that when somebody calls, it goes to another person. They can validate it before telling you, notifying you that you need to call a number for a specific concern. But make sure that the person screening your call knows the real score. And then keep documents in a hiding place, and that could be done at home, or better yet, in a separate area near the house of a friend, or even in the vault in the bank, possibly. Those things are the ones that you have to consider when you are dealing with domestic violence. The priority definitely would be ensuring your safety both physically and digitally. Next, okay, remember, domestic violence is a cyclic phenomenon. So do not believe when your abusive partner eventually would kneel before you and beg you to come back. No, never again. Do not put yourself into the abusive relationship twice, okay? It's a cycle. They will not stop. That's the kind of love expression that they were brought up to. That's why they think that's the right way of loving a person, which is very abusive. Next, toxoplasmosis. Now take note that this is a parasitic infection. Toxoplasmosis is caused by your Toxoplasma gondii, which is a parasite. The difference between a parasite and a virus and bacteria would be your virus and bacteria can survive even outside the body. The parasite depends on your body to survive. Okay, so toxoplasmosis is initially asymptomatic, and then eventually when the patient develops symptoms, this could last for approximately 3 to 4 weeks. And that begins with, since this is an infection, begins with fever, then swollen glands or lymphadenopathy, and of course, muscle aches. Now, the most important thing that you have to remember for your test is what's the common mode of transmission. One would be cleaning the cat litter box, okay? And this is not a good idea for pregnant patients, or eating half-cooked meat. Therefore, avoid exposing yourself to the cat litter box where usually your toxoplasma is excreted by your cats. And then you will need to cook your meat properly. And that simply means the temperature should be at least 60 to 70 degrees centigrade. Okay, 60 to 70 degrees centigrade. And you make sure that the water that you are drinking is boiled. And take note, the treatment would usually involve the administration of antibiotics like pyrimethamine. Okay, pyrimethamine is the most effective drug for toxoplasmosis. And sometimes your pyrimethamine is administered with leucovorin, which is your folinic acid. Now take note, your leucovorin will help prevent bone marrow suppression that could be associated with your antibiotic, pyrimethamine. Okay, so the most important thing, therefore, that you have to remember about toxoplasmosis is how to prevent it. And that should form your discharge instruction to your patients. Okay, now remember, toxoplasmosis is transmitted to humans through cleaning cat litter boxes or ingestion of half-cooked meat. So you will have to instruct your patient to avoid these activities. The functional concepts are really, really very useful as a teaching and learning method, okay? So second, you have to know how to study by using technology. Here at the Ray Gapuz system, we have world-class publications published by well-known publishing companies like Mosby's and Jones and Bartlett USA. And of course, the latest technological advancement that we have at the Ray Gapuz system, the secret tool of all our next generation nclex-pn passers, we have the Ray A. Gapuz system core shells that deals with all the subject matters on the NCLEX, safety and infection control, basic care and comfort, health promotion and maintenance, management of care, physiological adaptation 1, 2, and 3, reduction of risk potential, and psychosocial integrity. And the third secret to passing the test is actually to be in a conducive environment, which means the environment should keep your focus. Like how we do it. We have our own NCLEX simulation room that you can use anytime you want, having the same experience like the actual exam. That's the key to do it. And of course, our very, very intimate classes done in conducive environment. So let me invite you to engage in our next generation NCLEX-RN Flex, the most flexible test prep class for the NCLEX-RN. Your choice of live face-to-face class, virtual class, on-demand and limited video recorded lessons, the Q-Bank, 3 books, Next Generation Strategies and Sample Questions by Dr. Gapuz, that's me. Okay. And of course, the 24 hours, 3 days quick fix session. The fee starts at $3,499 to inquire for either a morning weekday class or an afternoon weekday class, or even a weekend class. All of these classes are available for you. Give us a call at 0906-201-9383. Once again, this is your mentor, your fact check buddy, Ray Gapuz, joining you in this pointers and tips video. Till my next video, remember, a functional concept a day keeps your nclex-pn fears away. Next generation nclex, coming from an expert's point of view. So let's begin with Risperidon. That's the generic name, or Risperdal, the brand name. Now take note, this is an atypical antipsychotic. When we say atypical antipsychotic, focus on this class. It will definitely decrease or manage both the positive and the negative symptoms of schizophrenia. When you say positive symptoms, remember DH lawak, delusions, hallucinations, looseness of association, okay, agitation, word salad, ambivalence, and confusion. And when you say negative symptoms, these are the symptoms that always begin with the letter A, except for ambivalence and agitation, which are positive symptoms. So the negative symptoms are alogia, or poverty of speech, or illogical speech, apathy, or blunting of the affect, dulled emotional reaction, absence of emotional reaction, asociality, which means the patient is socially withdrawn, avolition, lack of motivation, or they do not find engaging in interactive activities. So that's avolition, lack of motivation. And then anhedonia, lack of interest in pleasurable things, including sex. Okay. So what I'd like to highlight regarding Risperidon is the most common side effect, which is dryness of the mouth. Now, take note that when drying of the mouth is drug-induced, it's not prudent to increase fluid intake of the patient. That could potentially lead to fluid retention. That can potentially result to your dilutional hyponatremia. So the best intervention for the drying of the mouth would be to instruct the client to chew on sugarless gum. And the other side effects would be nausea, vomiting, diarrhea, and constipation, NVDC. Now, pay particular attention to the fact that your Risperidon have adverse effects that you would need to report to the healthcare provider or the physician right away, like irregular heartbeat, which could progress to arrhythmia and seizures, and definitely neuroleptic malignant syndrome. The neuroleptic malignant syndrome is characterized by 3 common manifestations. You have your hyperthermia, temperature above 38.5 degrees centigrade. So the drug that is given to manage that is bromocriptine or parlodel. And of course, you have muscle rigidity that could be managed by amantadine, and of course, your dantrolene or dantrium, and diaphoresis, which usually is managed by administration of IV fluids. Now, patients with neuroleptic malignant syndrome could also have altered level of consciousness. So pay particular attention to those things which I have highlighted for Risperidon or Risperdal. Next, remember this functional concept. Risperidon is an atypical antipsychotic used in the treatment of schizophrenia and bipolar disorder. So usually, your Risperidon is given together with your anti-manic agents, lithium, primarily to control agitation because lithium is not fast-acting enough. So remember, the effects of lithium occurs after 1 to 2 weeks or 10 to 14 days. So while we're waiting for the effects of lithium, your Risperidon would usually be exerting its therapeutic effect. Remember, it's an atypical antipsychotic. Next, you have your Loxapine or Loxetane. Once again, your Loxapine or Loxetane is also an antipsychotic. But to differentiate it from Risperidon is atypical antipsychotic. Your Loxapine is typical antipsychotic. Now, what's the difference? Your atypical antipsychotic like Risperidon will decrease both the positive and the negative symptoms of schizophrenia, whereas your typical antipsychotic like Loxapine or haloperidol, Haldol, okay, this will just decrease the positive symptoms of schizophrenia. And when we speak of the positive symptoms of schizophrenia, we have DH LAWA, okay? Delusions, hallucinations, looseness of association, agitation, word salad, ambivalence, and confusion or confused thoughts. Now, what are the common side effects of your Loxapine? First and foremost, the drug will cause drowsiness. So there's always a risk for the patient becoming dizzy. So it's very important that the bedside rails are up after the drug is administered, and the patient may experience pseudoparkinsonism like mask-like face, pill-rolling tremors, bradykinesia, monotonous voice, and they can potentially develop tongue twitching or lip smacking, that's your tardive dyskinesia, and restless leg syndrome or akathisia. Now, let me highlight one important thing. Your Loxapine, which is a form of typical antipsychotic, like your haloperidol, may potentially increase the secretion of prolactin that could lead to galactorrhea. So you will hear patients taking this medication, Loxapine, to be telling you that they have milky nipple discharge. Do not mistake that for a delusion. That is not a delusion. So even if you have a male patient taking Loxapine and the male patient is telling you that there's milky nipple discharge, you consider that, you document it as a side effect of the drug, because your Loxapine can really cause enlargement of the male breast, okay? So pay particular attention that this is a side effect of the drug, meaning, medical terms, gynecomastia. Now, for females, on the other hand, there could be an alteration of menstruation. So the menstrual cycle could become irregular for the patient who is taking Loxapine or Loxetane. Pay particular attention to the side effects which I have highlighted. Remember, Loxapine is a form of typical antipsychotic used in the treatment of schizophrenia and may cause, as I've been telling you, galactorrhea, okay? Or you have your milky nipple discharge together with gynecomastia or enlargement of the male breast, okay? Next, you have your Cetirizine or Zyrtec. This is an antihistamine. It's used in the treatment of allergies like conjunctivitis, runny nose, and take note. When a patient with allergic reaction develops hives, okay, this requires immediate attention. Why? Because hives can potentially lead to throat swelling. So like if the patient has taken some amounts of peanuts and then eventually the patient develops hives, that could potentially lead to laryngeal edema and airway obstruction. So instruct the patient that if they experience sedation when they're taking Cetirizine, the best time to take it is in the evening. But if they're not experiencing sedation with Cetirizine, they can take it at any time of the day. So remember, hives would require the nurse's immediate attention. That's why you have to be ready with your Cetirizine, okay? Remember, Cetirizine is used to treat conjunctivitis, runny nose, and hives. So the second important thing, if you are studying for the NCLEX, use technology. Once again, here at the Ray Gapuz system, we have the best technologically aided learning environment with our publications and, of course, our Ray Gapuz course shell, the tool that's assisting a lot of nurses worldwide pass the NCLEX next generation on their first try. So give us a call or send us an email message to avail of this for free. We're going to have it raffled off for the free access on June 25. So keep watch and register early. And of course, the third one, conducive environment. So we have here our NCLEX simulation room at the second floor of the Ray Gapuz building at UN Avenue. And of course, our very intimate and well-managed class. Okay, so may I invite you to join our next generation RN Flex, the most flexible test prep class for the NCLEX RN. Your choice of live face-to-face class, live virtual class, on-demand unlimited video recorded lessons, QBank plus 3 books, and then the next generation NCLEX strategies and sample questions by Dr. Ray Gapuz, including your 3 days quick fix session. The fee starts at $3,499. Once again, this is your mentor, your fact check buddy Ray Gapuz, saying thank you for joining me in this video. Until our next video. See you